Good morning. This is Sophia Delaviore with the RHSC. I just wanted to welcome you all and let you know, for those of you who are already on the line, that we'll be getting started in just a few minutes, and all of our attendees are automatically on mute, just so you're aware. But feel free, if you have any questions, to type in any questions into the chat box or the questions box. Good morning, everyone. This is Sophia Delaviore again with the RHSC. We are going to get started in just a minute. I just want to give people a couple more minutes to join. I see a lot of people still logging on, and then we'll get started. Okay, good morning, and to those of you who just joined, this is Sophia DeLaviore with the RHSC. So we'll get started now. Just a quick housekeeping note. All of the attendees are on mute to limit the background noise, and we will go through the presentation, and at the end of the presentation we will have some designated time for question and answer. And the way that we'll do that is you should see a little question box that you can type into on the webinar platform, and then we'll have a moderated question and answer. We'll read any questions out loud and respond to them. So if you have any questions or as any issues come up, feel free to use the chat or questions boxes throughout the webinar. If you have any technical issues, I'll try and respond to those the best I can, but any content issues and any content questions will be addressed at the end of the webinar. So I will now turn it over to RHSC Director John Skibiak.
Thank you, Sophia. It's a pleasure to welcome everyone here today for this webinar, which we've organized to launch the 2017 edition of the Family Planning Market Report. This is the third year that our two organizations, the RHSC and CHI, have worked together to produce this snapshot, if you will, of the public sector market for contraceptives. But it's a collaboration that really brings to the table a host of players, from the manufacturers, both innovator and generic, to partners such as the Concept Foundation, which plays an important role in consolidating the data provided by generic manufacturers, to the many individuals who've played a critical role in reviewing and providing feedback to preliminary drafts of this report. This really direct relationship with manufacturers is especially noteworthy insofar as it serves as a shining example, I think, of what can be achieved by our community through data sharing and joint collaboration. For us in the RHSC, this is a particularly, I think, sort of auspicious sign as we move towards standing up a new global family planning van, which promises to offer greater visibility into family planning commodity flows from manufacturers to ultimately, with the engagement of countries in their own country vans, the last mile. In many ways, though, the findings of this year's report are particularly salient because they speak to a concern that really has dominated more than a few discussions in our field over the past year, particularly since the elections last November in the U.S., and that is the fear of declining donor support for family planning and contraceptives in particular. Earlier this year, we in the RHSC published a costed commodity gap analysis, which highlighted the risk of a growing disparity between available donor funding and the cost of supplies needed to sustain historical increases in contraceptive prevalence to 2020. We concluded by showing a potential gap of almost $765 million. Now, we did put this gap into some perspective, however, by highlighting just how much of the total commodity cost is in fact met not by donors, but out of pocket. In fact, between 54 and 55% of costs were associated with this sector. But for those countries dependent on donor support, this breakdown represents really little consolation. And so here, for the first time in 3 years, we have a family planning market report that highlights what is described as a sharp annual drop in the value of donor-funded commodities shipped to the 69 FP 2020 countries. Now, the report is cautious in how it explains this decline and asks whether this is really, a sign of things to come, a function of the methodology that was used in preparing this and previous reports, or the consequence of confounding factors, which the report explores in some detail. But for me, and I think for many others in this community, the overriding message is clear. We can't just assume that commodity procurement will keep up with growing demand, or donor support for commodity procurement will keep up with donors' demand, or growing demand. And so this report, really, to my mind, is a welcome and really essential piece of evidence in our ongoing struggle, be it among advocates or other policy experts, to ensure that funding flows remain fluid, whether that is donor funding, contributions from national governments, or out-of-pocket expenditures by those with the ability to pay. So I'd like to close my opening remarks by thanking again CHAI and the many other partners on this call. I believe we have almost 40 people on this call right now. And by handing over the proceedings to my friend and colleague at CHAI, Alan Staple.
Thanks very much, John, and good morning, everyone. This is Alan Staple, head of the Global Markets Unit at the Clinton Health Access Initiative. I think John has set the stage very clearly for what we intended. Years ago when we launched this report, it was meant to help everyone in the community understand the dynamics of supply and demand, and to have a useful database for assessing policy options, including both funding and programmatic work on the ground. So we're very pleased that that goal has been achieved, and that this has now served as kind of a catalyst for focusing in on some of the key issues around funding and what will be the source of funds going forward for the very rapidly growing cohort of younger women that are seeking modern methods of contraception. Let me also just recognize and thank Klaus Brill from Bayer, who was one of the first folks to suggest that better data might lead to better policy and eventually better health outcomes. He's been a tireless campaigner over the years for access to contraceptive products, and we appreciate his support and leadership over the years with this data collection effort. I would also like to thank the 15 companies that have very graciously invested their own time and resources to provide the data to CHAI so that this report could be produced. So let me hand over now to Eleni, who I think is going to take us through the highlights of the report, and then we'll all be online to take any questions that may come up.
Thanks very much, Ellen. So for today's agenda, I will go over a quick overview of the Global Markets Visibility Project, of which this report is the product. Then we'll dive into the overarching high-level market trends that the report discusses, and finally end on a discussion of the report's findings and implications, and open up the floor to questions. And for those of you who just joined, you can type in questions throughout the presentation in the questions box, and we will be addressing them at the end. So as Alan mentioned, the historic purpose of this project and this report was really to address information gaps in the reproductive health commodities market. And this initiative is particularly unique in that it uses shipment data from suppliers to provide the most comprehensive and reliable view to date into the FP 2020 public and social sector family planning procurement market. Suppliers provide confidential data to CHAI, which is managed in a secure database and is ultimately used for the production of this annual report. You can see the list of 14 supplier participants that are currently involved in the project on this slide. And this supplier base represents the majority of suppliers that are supported by donors. The impact this initiative has is that it's really enabled donors, suppliers, countries, and implementing partners in the family planning community to make strategic investments and procurement decisions to serve contraceptive users. Now, I mentioned this report is based off of supplier shipment data. And so I want to go over this slide quickly to make sure we all have a basic understanding of what is shipment or procurement data, particularly as there have been recent reports comparing procurement analyses to consumption or demographic-based analyses. So while consumption patterns help inform procurement needs, there are other supply chain considerations that vary by country that may also factor into a country's decision to procure volumes, and this in turn would affect global procurement. For example, a country's supply chain design affects the amount of inventory required to fill the pipeline. The more stock points and the more infrequent distribution occurs, the more inventory is required. Another factor is whether programs are scaling up or down. As average monthly consumptions increase or decrease for products, inventories would also need to increase or decrease. Procurement quantities account also for current inventory levels. If a country is overstocked, they may procure less than their forecasted consumption, and vice versa. And finally, to respond to demand volatility, adequate buffer stock is needed at each point in the supply chain in order to have sufficient quantities of products in place to serve clients. Now, this is by no means an exhaustive list or understanding. It's really meant to just provide us with some context as we go into looking at this year's report's analysis. So with that understanding of procurement data in mind, let's talk a little bit about the components of the report and what's particularly noteworthy this year. The report is structured into 3 main sections and uses 3 sources of data. The first and main body of analysis is the supplier shipment analysis, which uses the supplier shipment data that we receive. The second part looks at donor-funded shipments using the Reproductive Health Interchange, RHI, to analyze donor trends. And finally, the last section, the market's visibility analysis, is something we started last year, whereby we take an additional look into countries where we believe we have limited visibility based on this supplier base by looking at publicly available sources of data, such as MOHFW reports. Now, as Alan and John both alluded to, this year's report is particularly interesting due to the 2016 shipment data we are seeing and what that means as a trend. And something else that is new is we've onboarded one additional supplier since last year's report, Techno Drugs, who are a major player in the Bangladesh market. So let's dive in now into the report, and we'll start off by looking at the report scope and overall coverage. So the Family Planning Market Report is focused on the 69 FP 2020 countries, public sector only, which is defined as Ministry of Health or government, and institutional buyers, which include UNFPA, USAID, and the social marketing sector. It does not include the commercial sector. So there's a distinction here I'd like to call out, as depending on the analysis, sometimes the social sector is counted as private. In this case, we have counted them here as institutional procurement that is part of the public sector. The report is focused on product-based modern methods only. So this table that you see here is showing the aggregated volume from suppliers from 2011 to 2016 to the 69 FB 2020 countries, with the exception of male condoms, which we take from RHI due to a higher fragmentation of the market. And we do not currently have the best coverage with our current supplier base. What's important here to note is that in almost every year, the market report volumes exceeds the volumes that are seen in RHI in each of these methods for the 69 FP 2020 countries, which again just speaks to the comprehensiveness and breadth of the report. So diving right into the trends that we'll be looking at today, this graph is showing us the market value or market size of contraceptives. The major trend we see from this year's data is a steep decline in the market value of family planning product-based commodities from 2015 to 2016 of $78 million, or a decline of 28%. This decline was driven by a decline in shipments across all methods, with the exception of IUDs. In particular, there was a sharp decline among injectable volumes from 2015 to 2016. Looking across 5 years from 2011 to 2016, we see the same trend of an overall decline, but there are some noteworthy differences at the method level. While the market value of LARCs, which are the yellow and orange bars, increased by 6% annually from 2011 to 2016, it was counteracted by the short-acting methods decreasing by 12% annually, which are the gray through light blue bars. And within short-acting methods, we see a 21% annual decrease among orals combined in progestin only from across the 5-year period. The next graph looks at the market from a different lens using CYPs, which allows for more of a normalized or standardized view. We see the total number of CYPs shipped from 110 million in 2011 to 104 million in 2016. This is a decrease of an annual rate of 1% for the period. Now, this CYP's decrease of 1% annually for the period is much lower than the 7% annual decline of the market value from the previous slide for the 2011 and 2016 period. And this is due to the continued shift towards long-acting implants. That said, it is still the lowest number of CYPs shipped in 6 years. Now, these two graphs show market share of each method as a percentage of the market size, which is the graph at the top. And the graph on the bottom looks at CYP mix as a percentage of total CYPs per year. In 2016, we see long-acting methods increase both as a proportion of the market value and CYP mix from 2015. In 2016, the market value was 42% of LARCs and 73% for CYP mix. Now, this is due to the decrease in short-acting methods, and therefore LARCs increasing is due to a percentage increase as the total. This slide looks at the donor funding analysis portion of the report, which uses the reproductive health interchange data. The 3 colored boxes you see here constitute the donor-funded market. The gray is USAID, the dark blue is UNFPA, and other donor-funded is the light blue. The dotted lines are the difference between the supplier data and the donor market, which we've deemed as additional global markets visibility volume that are part of the public sector. So as we can see, from 2015 to 2016, there was also a substantial decrease in donor spending in the 69 FP 2020 countries from $186 million to $137 million. Prior to 2016, donor spending was relatively stable from year to year. And these trends are consistent with what we've seen in the supplier shipment analysis for the overall period of 2011 to 2016. As a result of this, total CYPs from donor-funded shipments decreased by 9 million, from 65 million in 2015 to 56 million in 2016. That said, the 2016 donor-funded shipments still accounted for approximately 54% of the total CYPs shipped, compared to 53% in 2015. Now, before we open the floor with Q&A, we wanted to start off the discussion by highlighting some of the reasons we identified for the market decline seen from 2015 to 2016. These were developed with the help of suppliers, donors, and partners. When we recognize that, further data and analysis would be needed to vet these hypotheses. So the first hypothesis is the real possibility that a decline in donor-funded shipments has resulted in a decline in CYPs, as other procurers such as government and social marketing organizations are not sufficiently covering the shortfall. From 2012 to 2016, We know that CYPs shipped to the total FP 2020 public sector decreased by approximately 19 million, and CYPs as implied by the donor-funded shipments also declined by a similar amount of 17 million. So this could indicate that there is a direct correlation between the lower volumes of donor-funded contraceptives shipped and the decline in overall FP 2020 public sector CYPs shipped. The second hypothesis is the idea that public sector procurement may have shifted to other sectors and or to local and regional suppliers that are not participating in this report. In our conversations, certain suppliers contend that in large countries such as Bangladesh, India, Indonesia, and Pakistan, procurement is shifting to local and regional suppliers who are not donor supported. When we refreshed the 2016 analysis of Bangladesh, India, and Indonesia, the market's visibility analysis for this report, the data derived from purchase orders and procurement reports from these three countries seem to support this hypothesis. Finally, the last hypothesis is that the decline can be attributed to procurement pattern fluctuations. So as we determined at the beginning of this presentation, countries procure stock based on their unique in-country supply chains and in-country demand, both of which may vary year to year as programs are scaled up or down. Therefore, some plausible explanations for the 2016 shipment decline could include that there were sufficient inventory levels at the end of year 2015 in certain countries, and thus these countries decided to procure less in 2016. Some countries may also have decided to procure the bulk of their shipments in late 2015 or early 2017. And finally, 2016 was a transition year for USAID as it moved from one procurement agent, USAID Deliver, to another, USAID PSM, Procurement and Supply Management. And this may have also contributed to overstocking in prior years and underprocurement in 2016. So the best way forward is to look at the 2017 data. We can increase visibility through additional supplier participation, and I believe we can also keep a pulse on consumption data or demographic-based analysis to see if this decline is going to be continuously reflected. And just to end on a plug to read the report for more detail, and also if there are any suppliers listening on the call that might be interested in joining the project, to please contact me at the information on the slide. So I think now we can open it up to see if there are any questions from the audience. And just a reminder to folks that you can type it in. So just give us a moment here. We're going to get ourselves organized to look at some of these questions. And I also want to mention that if we don't get to a question that you end up putting through on the call, we will be following up as we did last year with a written Q&A document, which will be distributed along with the recording of this webinar. And actually, that is one of the questions being asked. Is this presentation available online? It will be after this call. I believe this is more of a comment. With increasing demand for spacing and limiting in the absence of reliable contraceptive supply, should be beginning to look at medical abortion supplies to better understand trends in unwanted pregnancies. I think that that is an interesting question that obviously currently the report scope does not cover abortion supplies. It's focused on product-based modern methods of contraception. And I wonder what that would look like. I don't know if John or Alan or anyone else has any perspective on that.
Hi, Eleni, I see there's silence on the phone here. Are we still connected? Eleni?
Yes, I'm still here.
Okay. But I think.
Yeah. Go ahead.
No, I was just going to say. I think it's a good question. I think the challenge probably is that given this methodology and the approach we have here, as you said, we have the manufacturers who are now involved in this product and this project, and I think those manufacturers who are manufacturing medicines for medical abortion are really a different set of players than the manufacturers represented in this study. So, while I think it's an interesting idea, I'm not sure how feasible, in fact, it would be to do that within the context of this. And also, certainly in the case of USAID, its funding obviously does not go towards medical abortion, and they make up half of the funding, public sector funding that we see in this report. So, yeah.
That makes sense. There's another question here of, for the issue of USAID moving from USAID delivered to PSM, have you spoken with USAID about their procurement schedules, which have or would affect this year-over-year data? And the answer is yes, we have spoken to USAID and PSM. They were instrumental in the development of those 3 hypotheses that we walked through. And the last hypothesis, which focuses on the procurement fluctuations, was something that we talked with them extensively about. And the point about the fact that their procurement schedules, particularly in this transition as PSM ramps up this year, that was something that was also brought up and definitely could be contributing to this decline as well. And so the idea there would be that we might see some uptake in 2017. We have another question here on what is the role of insurance programs in this analysis? As we move towards universal health coverage, where should the community focus on ensuring reliable supplies? I think that insurance is definitely an important source of financing. It's definitely something that the community should consider. In terms of how that reflects in procurement and shipments, it would have been captured since we do cover institutional buyers. If it's private insurance that we're discussing, that would be captured in the commercial sector, which is out of scope for this report, but it's something that we are also working on potentially adding more visibility. And it doesn't look like, oh, I think there might be more questions coming through. So this is a question on the injectables trend. Given we are already 11 months through 2017, what does the trend look like for injectables after the very sharp drop last year? So this is a great question, and this question requires us to maybe give a little bit of context as to how the process for aggregating the data. We currently receive annual data from suppliers because we know that there are certain factors that would sort of influence the procurement throughout the year, perhaps, that it would make the most sense to look at it on an annual basis as opposed to at midpoints during the year. And so the data collection would occur early next year for when we would be able to see the 2017 trend.
Hi, Eleni. This is Sophia. I just had somebody email me that they can't find the question box, so I'm going to try and unmute Ellen Starbird, if that's okay, so she can just chime in with her question.
Sure. Perhaps if I can just add one more comment to the last question, which was still on the injectables drop, is that, again, just reiterating that we saw this decline from 2015 to 2016, and 1 year is definitely something that we do not want to look at in isolation, and definitely want to be looking at beyond just the 1 year. Go ahead, Sophia.
Okay, Ellen, we should be able to hear you now.
Okay. Can you hear me?
Yep.
Yes.
Great. Thank you. Thanks very much for the webinar and for the report itself. I guess my question is around the information we don't have here about the rest of the market beyond what people may be procuring through donors, etc. And I think to have a full sense of whether we find ourselves in an uncomfortable place or not, it's important to have the rest of that information. I think the point that donors are unlikely to be the sustainable source of contraceptive procurement is accurate. But I don't have a sense, I can't get a feel from the report about whether we're in a danger zone or whether what we're seeing here is just a trend towards people procuring from other sources.
Thank you, Ellen, for that comment or question. I think you're absolutely right. That is definitely the question that everyone is asking, and these possible explanations that we came up with through consultations with partners and suppliers are at this point still hypotheses, and they would need further data and further analysis to be vetted. We tried very much to analyze the report, the supplier data, with an unbiased view. And, when we did these consultations, it was to add more color to whether or not this could be, as you put it, a danger zone that we're entering. And I think, again, reiterating the fact that this was a 1 year trend, whether or not that is going to be a sustaining trend going forward requires us to look at more data from suppliers, and also see if we can increase the coverage through other sectors, such as perhaps bringing in the commercial sector. Now, I will say that from a public sector and social sector perspective, the entire community has difficulty with, and as we compare to the other publicly available data source that's out there, RHI, this report covers more than what we see there. So at this point, from a public and social sector perspective, this is sort of the best data source that we have.
Yeah, thank you. I think I would concur with where you're going in terms of us working as a community to see what we can do to fill in the rest of the picture.
Yes.
At some level, I see it as progress, or done well. I think it would be progress for countries not to be relying on donors for their commodity purchases.
Mm-hmm.
Anyway, thanks. I'm happy to go back on mute. Thank you very much.
Thanks, Ellen. And I just wanted to say, if others are having any trouble typing in a question or wanted to voice their question verbally, there's also the little hand-raising feature on the webinar platform, and I can try and unmute you individually as long as you've connected with your audio appropriately. So I'll look out for any little hands raised and try and unmute you individually if you wanted to chime in. So feel free to also continue writing in questions.
If there's no other questions and folks think of questions afterwards, they can always email us. My contact information is on the slide. It's definitely an option. Okay, I see a couple more coming through.
Well, I see one hand raised. I'm going to try James. James, can you try and talk?
Hi, yeah, no, I did. I think there may be an issue with the questions being submitted. I submitted one several minutes ago, but doesn't seem to have gone through. It was really, if I can just go straight to the question, I'm assuming everyone's hearing me. It was around this hypothesis B, I think it was, Eleni. And I was interested in hearing a little more evidence around that. You said that there was some which supported the view that at least in some regions and countries we were seeing the gap being, or perhaps it's not a gap, we were seeing governments and other procurers picking up their volumes, and it'd be interesting to hear a little more on that.
Yeah, absolutely. So what James is referring to is hypothesis B, which I've flipped back to the slide, and you're specifically referring to the section of the report, which we didn't have included in this presentation, but folks can definitely see it. It's the additional markets visibility analysis. And essentially what we did was take an additional look into large countries where we felt that we may not have the best visibility given the supplier base. And we looked into Bangladesh, India, and Indonesia. And we looked at publicly available data sources, MOHFW reports, government tenders. And these informed us that there are procurement of product-based modern methods of contraception that are occurring in these countries from local and regional suppliers. And if we look at just pulling up the report for the numbers, in Bangladesh, we saw roughly 8 to 13 million CYPs in the last 2 years. In India, it was 58 million, 54 to 58, and Indonesia 17 to 23 million CYPs. So this is, these numbers are significant. And this is, again, still looking just at the public sector, just from government tenders and MOHFW reports. So this would sort of contend and support hypothesis B in that there is procurement happening within these countries in suppliers that are not participating in this report yet. And that is something that we are also increasing visibility on. The supplier that joined this year was also identified through this analysis last year. And so now we have a bit more visibility from those countries.
Is it possible just to come back on that quickly? And am I right in interpreting that so that might be evidence that the total market might not have dropped to quite the extent that that those figures, the headline figures, signal, but given that UNFPA and also USAID aren't big providers of commodities to those three countries, Bangladesh, India, Indonesia, even if that's an impact that's moderating the total volume, we've got a distributional question to answer, right?
Mm-hmm. Yeah, that's an interesting question. I think it's a bit difficult to triangulate, mainly because we only have, in those publicly available sources, we only have 2015 and 2016 data. And even then, it's difficult to triangulate the actual timing based on fiscal year differences and whatnot. But it's difficult to understand if this procurement was always happening in the past versus, has it really, we haven't seen, a giant uptake in this procurement, for example, just looking at 2015 and 2016, it's been relatively similar. So I can't say for sure that this would be evidence that, procurement has ultimately shifted. It's just saying that this procurement exists in these countries, if that makes sense. There's a question here around CYPs. For CYP analysis, are methods counted using the maximum duration of each method, which may then overcount the actual CYPs given move towards LARCs, which may not be employed for the entire possible duration? So CYPs, what we've used in CYPs here are the standard, I believe they're published on the USAID website, the standard CYPs, the standard effectiveness, and the average duration of use. So, for example, I believe for 3-year implants, the duration is 2.5. So it's not counting for the total maximum, and therefore it's not inflating the actual CYPs. There's a question here around the demographic size and whether it will continue to grow. So as the demographic size of the potential client segment continues to increase, is our ability to meet needs more compromised by this drop in supplies? Given this backdrop, how will the growth in client population and effective demand affect commercial markets? So I think the first question on whether or not our ability to meet the growing demand, whether it's compromised by this drop, is dependent on a number of things. Whether or not this drop is real, and looking into what might be causing it. So if financing, for example, is a potential cause of this factor, then whether or not the future of financing from a donor perspective, perhaps, that will certainly affect our ability to meet those needs, if that is in fact the lever that is causing this. Whether or not commercial sectors can adequately ramp up I think is another sort of thing to think about. And to the extent that they are affordable and accessible to meet this growing demand, that will sort of have a big impact on whether or not on the sort of future of the commercial sectors as well. I think this is a good question, and it's a broad question for the community to address. Were there any other questions that perhaps didn't come through? The question box is very small on my screen, so I apologize. I'm not seeing anything else come through. Sophia, do you see anything else coming through?
Nope, no hands raised.
Great. Well, if there's nothing else, perhaps we can conclude.
Thank you, Eleni.
Thank you.
Thanks very much, everyone.
Thanks very much. And this recording will be available on our website. Okay.
Wonderful. Have a
Thanks,
great
everybody.
day.